Welcome everyone. Webinar number 15, and this one is very close to my heart. This number 15, we're going to look at Spidertech and golf. Hope you've had a great day so far. Golf is actually how I got into being involved with Spidertech, and I started to use the different pro cuts on the athletes I worked with great success, and so that success turned into more and more association with the company. And so, as I said, this one is near and dear to the heart, and I'm excited to bring you webinar number 15, all about golf. As you know by now, our mission is to arm every one of you medical professionals out there and allow you to elevate your clients' recovery by arming you with the streamlined kinesiology tape solutions, giving you the highest quality tape, the highest quality product, so you pass that experience on to your patients and clients, is what we strive for here at Spidertech. My quick bio here, certainly is a long history of golf, starting off with playing Division I golf down in Pittsburgh, Pennsylvania. And then when I wasn't going to be a very good professional golfer, I set out to help those athletes do what I couldn't do, which is get further and become professional and get as good as they could possibly be in the sport. That took me down the road of becoming a chiropractor and then getting involved with the sport. I've been lucky since then to be involved with our Provincial Golf Association for over 10 years now. And then also, as I mentioned, this is how I got involved with Spidertech. We were using kinesiology tape to help our athletes both while they compete. It's a product that there's no comparison, because it's something they can wear and receive benefit from while they compete and while they're on the course. And then also once I started to really wrap my head around all the capabilities of what kinesiology tape can do, understood that there's way more possibilities there, and so we started trying to correct or help swing faults with taping different areas and achieving different things, working with golf professionals and coaches. And so yeah, it's been a long, fun ride, and a lot of the piece comes back to golf. Today's webinar, we're gonna keep it as exciting and as straightforward as possible. We're gonna look at how we can use Spidertech to help with performance on the course, and also to help with injury, which is performance. If they can compete at a higher level when they're sore or injured, that obviously is a performance enhancing thing as well. And then also we're going to go over how to apply the tape to achieve these results. So we'll get some theory as well as some application involved. The thing that makes Spidertech special, unique, the leader in the field is their pro cuts. We are Canadian made from start to finish, and so as a result, we have the ability to constantly be improving our products. So we've gone and made different shapes and sizes for different parts of the body. As a result, everything becomes standardized. It's very simple to apply. It's long lasting because we don't need to use scissors, and it saves time, reproducible, and you can do it anywhere, including the golf course. And so I love traveling with Spidertech because I know I can just grab it from the bag, put it on, and I'm not reaching into a bag that the tape has been crumpled up from a roll. It's ready to go wherever you are. Okay, as we dive in here, our Spidertech and golf. I broke it down into a couple of different areas here. We're going to look at swing faults, and we get this from TPI. I went through all 3 levels of medical professional with TPI, so I finished the level 3 certification. And then looking at their swing faults, we kind of mold them into essentially 4 pieces or 4 postures, positions that we'll look at being able to help or augment the swing correction or the coaching with using tape. And so hopefully this gives you some ideas as to if you have someone who has this swing fault, we can kind of we know where to check in terms of where to apply tape, but also that also takes it down the road of just knowing where to check in general to achieve the best results as parts of the body. And then also it'll kind of give us an idea of how we can think about tape in how we can see improvements and then and all the benefits it has. And with that, we will do a research review where we kind of just touch on what the research says, which will A, prove my point, but B, it'll give you a expectation as to how much benefit you can see, what the results will end up being with each one of your golfers. And then also, which I think as a medical professional, the biggest reason you would tape a golfer is because they're injured or sore or dealing with some sort of issue that they're seeing you for. So we'll go over that application as well. And then fatigue kind of fits in there with that as well. So if we dive in, the first 4 applications that we're going to look at, or swing faults we're going to look at, is early extension. And the reason is because this kind of ties in a bunch of pieces. It's really the whole posterior kinetic chain. It starts from the ground up, which is why I started with this one. We can go from the foot into the ankle, the calf, the hamstring, the glutes, and then also into the low back is where we'll touch on today, all needing to be functioning properly and also being strong, stable, and mobile to get the best results with your golfers. So as we kind of break it down with the foot, we're going to touch initially on the tension of the tissue, which we're looking at kind of like the bottom of the foot up and through the Achilles tendon and then up into the calf. Dorsiflexion would be probably the most important motion with that area of the body, and then also that dorsiflexion has such a huge impact on ability to functionally move in terms of squats or lunges and really anything with the lower body. And we know if you can't dorsiflex, you probably haven't been able to get strong in those patterns. And so this is really a core piece of being able to express your athleticism. We'll also take it up into the hamstring, as I mentioned. We'll look at both from a muscle tension, movement pattern standpoint, and then again the glutes, looking at it from like a weakness, activation, proprioception type standpoint, and then the low back in terms of just getting the back to function normally, the patterns that we'll see. All right, so we dive into our early extension. We'll kind of start with our research to help along the way. I wanted to start with this one piece because it does set the stage for a lot of things we're going to be talking about. Muscle tension is a big piece, and so with what we can do with tape to help everything, certainly with early extension, muscle tension is where we're going to apply it. So that's where we're going to be ended up applying a bunch of the tape and also your therapeutic touch. So what do we expect with in terms of tension and stiffness? So if we separate both muscle tone, which would be what you feel as a practitioner, the muscles contracted when it should be relaxed, versus the stiffness, which is what their patient will kind of express as it feels sore or stiff. That's how we'll separate those two things. And the expectation that I see or I have as a result of just treating patients, but also with knowing the research, is that you will generally do a little better with tone than you will with stiffness. So if I have someone lying on the table and I feel that the muscle's tight or stiff, I'm going to do the best with that versus someone expressing it feels really stiff. But the results would be with our stiffness is that you're looking at pretty much a 30% improvement within 1 to 3 days. And then as we see here, this research project, or the research paper showed a 44% improvement after a week. And then the reported from the patient standpoint is usually about half of that. So I think within instantly to within a couple of days, I expect 20 to 30% improvement in the tone, and then the stiffness will generally be about half that. And then if we see with our stiffness here, as I mentioned, you get about half the results. And so I wanted to set the stage with that, which tells us, and hopefully that this is enough to believe, that the tape will take care of stiffness, and if you take care of stiffness, you can express different levels of athleticism, which is also where we can start to make the improvements in terms of these swing faults. Okay, and so it concluded in the study that this study underlines that physical therapy is more effective in improving muscle performance when it's combined with taping, and that the combined approach can be used as an important intervention strategy for patients with shoulder pain. I think you can extrapolate that to all pain and stiffness, but that is our beginning piece. All right, so we'll take that and we'll, as you can expect, someone with plantar fasciitis, which we'll call that the tension in the bottom of the foot. We expect to see improvements there as a result of what we just saw. And then predictably with this study, they saw, we'll click through, good. So we'll move into the next slide there, which shows how they taped for the plantar fasciitis. Give you some ideas about taping that area. And the study concluded that the application of the tape was found to be effective in improving balance and functional performance in subjects with plantar fasciitis. Again, something I see in the clinic all the time. I love using kinesiology tape for any kind of plantar foot tension. If when you kind of put the foot into dorsiflexion, if like a huge bit of the tension comes from the plantar side of the foot, then I'm getting tape on there every time. And then I've also done a bunch of work with the golfers we work with on the range, and that if someone generally, if they don't connect with the ground, if when they kind of come through impact and into their finish, if their toes flare up into the air like this, and they're almost kind of like just spinning on their heel, I'll get them barefoot on the range, hitting some shots. I'll also get tape on the bottom of their foot. If they have an issue with a flat arch, for instance, then I'll tape to help improve the arch, and as well as just all over the plantar side of the foot. And I really find that helps them re-engage their brain with what's happening with their foot, and they can start to get through the ball and grip the ground and have a much more connection with the ground itself through impact. And that generally will be kind of seen in a more reproducible impact position. And especially as they get fatigued, that's where you're just narrowing up the amount of motion that's happening in through the lower body and through the ground if they're gripping in there and they're able to connect. So a really important piece if you see that as your golfer's coming through the ball that their toes give her one of these, or if they have flat feet, to check there. All right, as we move up and through the plantar foot, the Achilles tendon, and into the calf, I mentioned that dorsiflexion was a hugely important piece, really for everything athletic, but certainly for a squat. And if you want to be strong in the golf, our golf postures, we certainly need to be able to squat and get low to be able to connect ourselves with the ground to create strength or speed. So this becomes a very important piece. And so with this study, it was on duathletes, and they measured our dorsiflexion here using this method here when they check the range of motion. I'll generally use a knee to wall test in clinic. I find it just much easier. And so the measurement I would generally use in clinic and we use with all the combines with our golfers, is they need to be over 10 centimeters or about 4 inches to kind of have the dorsiflexion required to express your athleticism. That's kind of our bare minimum. And as a result, what we saw was in this is that when using tape on the calf, we see a 1 centimeter improvement instantly in our dorsiflexion. And then we saw a pain reduction right away in addition to after the duathlon as well. So pain and range of motion was improved. This is something I do in all my inline or in-person courses. It is always astounding. People instantly they'll see an improvement. We'll do a knee to wall test without tape. We'll put tape on and then do a knee to wall test right afterwards. And 90% of the time, people will increase by at least 1 centimeter. And I think why I'll generally get better results with this is because in that study they did just the calf. When we do it in our courses, we'll get the plantar side of the foot up and into the calf, so like the whole back side of the foot and ankle and calf. And so I think as a result of that, you see the benefits of muscle tension going down all through that area. And so generally we'll see like at least 1 centimeter, but a lot of times you'll see up to about 3, 4, 5 centimeter improvement like that. And then, as you can imagine, their conclusion here is that we can increase dorsiflexion, and it's good for pain as well. Okay, so as we move up the kinetic chain, we're trying to clear out the muscle tension. We're trying to help with the coordination to help with our early extension. And we get into a study who looks at the hamstring flexibility immediately after applying tape, and they use an active straight leg raise test here. And so here's the tape application that they used, and pretty straightforward. What I would say is it's just really important to tape with the person in full hamstring stretch. You want to make sure that you put them in a full stretch position in terms of the muscle that you're applying over top of, so that way as they can never get beyond that range of motion, and they won't be able to take the tape beyond its ability to stretch, being that the kinesiology tape, Spidertech, has about 40% extra stretch in it from its beginning position. Okay, so what they saw, and again, just highlighting this, our thoughts with our muscle tension, is that right away we see that immediately there's a 7-degree increase in the hamstring flexibility using active straight leg raise, and then after 3 days we're looking at even a greater result. We're looking at between like 14 and 19 degrees improvement in active straight leg raise just by putting tape on the skin. And again, our mechanism, we're stimulating those skin receptors, primarily the Merkel cells, and then that helps to normalize the tension through the tissue as a result of just that interaction with the nerve receptors and allowing your brain to just let that tissue to relax and to normalize essentially the tension. And then as a result, we see with our conclusion here is that our study has revealed that the sustainability of tape significantly influences muscular elasticity for the hamstring and quadricep muscle group. It has also shown a positive impact on power output. The research suggests that the utilization of kinesiology tape for long-term use can be beneficial for athletic events that require increased hip and knee flexibility. All right. Okay. Also, because the mechanism that this helps the hamstring regain this elasticity is through stimulation of the nervous system. It's not just from stretching the heck out of it and increasing the length of the muscle. That's where I think we get those big improvements in terms of the movement patterns and kind of normalizing any kind of hamstring dominance that we see. If you get hamstring cramping, a lot of times instantly I'll get tape on there, and you can get rid of that cramping, just because again you're normalizing the nerve input and the nervous system part of that. And so for the people who generally have that dominance or that tension in the hamstrings, Spidertech is a fantastic way to get at improve that through the nervous system. And then moving up their chain into our glutes, we're kind of touching on all those on areas along the way. We see in this study that by putting tape on the glutes has an increased power output. And certainly the reason for this, I'm sure there's probably many kind of unique ways, and they explain it in different methods, but I think how I think of it is it just comes down to proprioception, comes down to being able to maximize how your brain controls the muscle. It's not that we're adding muscle fibers, it's not that we're making the muscle fibers any stronger. You're just highlighting, because of the constant interaction with the skin, the brain just knows more about the area, so you can be more effective in how you express that muscle's function. You can be more, your brain's more specific in how you use the fibers there. So I think that's the mechanism here. It's a proprioceptive thing. It's about just kind of having more awareness. And so, as I mentioned before, with the hamstring, if you're hamstring dominant or if your glutes don't activate, Classically, Tiger would mention that he had a bad day because his glutes weren't activating, and that was causing some back issues. And you look at Tiger's glutes and you say, how could that be possible? How could they not? Like, they look big and strong, but it comes down to just your brain being able to kind of have full awareness of where that is in space. And I think that's how we increase our power output using tape. And so with this study, what they did was they used application like this. They also just used strips in addition to that. And what they found was that it didn't really matter how you tape the glutes. As long as you had tape on there, you were going to see some benefit. And so, in conclusion, it would appear that kinesio tape applied to the glute maximus muscle of healthy young male athletes significantly increased short-term vertical jump height as a proxy for explosive muscle power over time in both methods of application tests in the study. The hypothesis that the application I just showed you would be better than just a straight strip method. That was rejected because it turns out all you had to do was just kind of get tape on the area and highlight the brain's awareness there. And the implication of this finding is that the athletes participating in the high jump may benefit from strapping using other applications within half an hour of jumping. So I think, again, interesting is that these things are right away too. So if you're about to jump on the golf course and you feel like you're working on you're feeling some glute soreness, some glute activation that's issue, you get tape on there, and it doesn't have to be days in advance. It's going to be instant. And so if that's an area where you feel like you're causing your early extension, get tape on there and you're right before you play, and you're going to see the benefits of being able to kind of sit into those hips better and use the glutes in a more functional way. All right, and the last piece of this puzzle, our low back, and this kind of fits with in my mind, this fits with our glute function, our hamstring dominance. If you see someone whose low back is kind of tight and always extended, they tend to arch their back through the ball, and they don't kind of sit into their hips and use their glutes in a functional way. That's where I'm going to get tape on the back and know that we can get those muscles to relax, and hopefully that enables them to reestablish that better pattern. And so with this study, they looked at chronic low back pain patients. Really simple. They had them bend forward, and ideally with a normal back, your erectors should relax as you kind of bend forward to allow you to go into full flexion. With some of the chronic low back pain, many times that doesn't happen. The erectors they stay active, and they kind of that's why they feel so fatigued. And so what they found with adding tape right afterwards is that 43% of people who had this faulty pattern of the erectors still being active as they touch their toes, 44% of them instantly had those back muscles relax once the tape was put on. Again, with our idea that we're normalizing our tissue tension, we're normalizing the muscle function by providing that constant rub on the skin, that constant feedback through the nervous system. And then from a pain standpoint, they also saw that 33% of people instantly said that they felt their back was at least 2 out of 10 better on a visual analog scale compared to where it was before the tape. So at least a 20% improvement in 33% of people. So again, an important piece, and you can expect someone who you would tape their back to help with their golf game is probably going to be a person that would have back pain or back soreness or back tension with golf. And then our conclusions is that kinesiology tape is promising as both immediate, important, and short-term pain relief therapy when applied to chronic low back pain patients. It rapidly reduces abdominal paraspinal EMG activity and may therefore be effectively used to complement a physical rehabilitation program. Make sense? And so I will always use the low back pro cut in this situation. Again, it's kind of the same thing we've done along the way. Anywhere you feel tension, get tape on there. I would say with tape, I'll follow pain a little bit, but I will always follow tension. If there's muscle tension that I feel is abnormal, I'm always going to get tape on there, and especially if I feel like that tension is going to help with patterns athletically or just within helping them live better. And so with our low back application here. We can just get a quick sense of how we'd apply it. Real simple. And as you can see, we're completely flexing forward, having the client completely flex forward. And that, again, that is to make sure we don't ever run out of range of motion. If we were to apply it with her standing straight up and then she flexed forward, if she went more than 40% of the tape's available flex, then we would run into problems. So to get past that, we'll always have them take full range of motion in the flex position, and then tape with no stretch on the tape going up the muscle we want to have an impact on. With our back pro cut here, it's the erectors and up and through the kind of through the QL, and really we're going up through the TL fascia and having impact through there. All right, so that concludes our thoughts on everything early extension, such a common piece, both from a structural or body mechanic standpoint, and then also this just clears out these things, and so you're the golf coach, the golf pro instructor can kind of get in there and make the technical changes. So a lot of these things is like making your athletes, your patients, ability to receive their golf coach's information way more effectively. So that's where kind of that teamwork is, because we open that window for them to be able to do more, and then their golf instructor or golf coach can go and cement those patterns with the right technique and the right movement patterns. All right, so we jump into our second piece here, which is our sway and slide. Again, we're going to start from the ground and move up. This is where we kind of look at our hips, both from a range of motion, from a strength and stability standpoint, and then as well from a proprioception standpoint. As a kind of a review, our sway is when we kind of like come off the ball into our backswing, and then we kind of slide through it. Through impact. Instead of rotationally moving, we kind of move laterally, which would be the faulty pattern. And so what our hope is with using tape, as well as all the other modalities we do, is that we can stimulate more of a rotational pattern, so they don't have to move laterally back and through the ball, which is going to affect their mechanics and also cause pain and issues on the golf course. All right, so our first study we're looking at is we're kind of taking a look at that range of motion, and the important piece is to identify what the tissue is that we're trying to have an impact on, and in this situation it is the piriformis, a muscle that affects rotation, and so that's what I'm going to look for. Generally, if I'm seeing someone who has a rotational issue, where I'm kind of going is I'm looking at it is it going to be a piriformis issue which will affect the internal rotation of the hip? Is it going to be a glute medius issue which can affect internal and external rotation, but certainly those posterior fibers can affect the internal rotation? And again, like with golf, like that internal rotation both into the backswing and through the ball is a little more commonly an issue, so that's kind of where we're going to bias that. But in terms of external rotation, certainly if we get a bunch of tension through the TFL and through the front of the hip, I'm definitely going to get tape on there as well. So it's about understanding what the tissue should feel like, what it does feel like, but knowing enough to check those areas is the first piece. So in this case, we see the piriformis is what they checked. They looked at from a trigger point standpoint. And so here's the tape job they did. They kind of covered the area where the muscle exists. Pretty straightforward. I would say that when I'm getting tape over this part of the body, I'm going to have the person sideline. I'm going to have them bring their knee up to kind of like the hip deflection and kind of bring the knee in front. Again, that's how we're going to stretch the area to make sure we don't limit any range of motion of the hip. And then as a result, what do we see? From a hip internal rotation standpoint, from a pre to post, or kind of a immediate standpoint, we see a 3-degree increase right away in terms of the hip internal rotation of the hip, and then a 7-degree increase over 3 days in terms of hip internal rotation by doing nothing other than applying tape. And again, I would say that's because you're applying a good solution for the right problem, which would be the tension through that area of the body. From a pain standpoint, they also saw that there was where the average person with this trigger point in the piriformis was a 6.5 out of 10 on the VAS scale right away. So instantly we're getting like a 20% drop down to 4.5, and then over the 3-day period we're down to just under 4. So we're constant improvement from a pain and hip rotation standpoint just by applying tape to the area. And then as we see here with our graphs, both from a range of motion and a pain standpoint, compared to control, we saw both improvements. And then I included the discussion here because I wanted to highlight the fact that it was kind of immediate. So the results of this study showed that a significant improvement in active range of motion and decreased pain intensity immediately following application, as well as 72 hours. And then they concluded that the improved range of motion and decreased pain intensity obtained from the study may suggest kinesiology tape application as a technique highly appropriate in patients with soft tissue involvement. Therefore, kinesiology tape can be prescribed for patients with trigger point, especially when pain relief and increase in range of motion are the short-term goals of the treatment. And certainly if we're looking at increasing our hip range of motion for golf, that is exactly what the goals are. Okay. We're going to kind of look at really like the strength of the hip and really important from both adduction and abduction, as well as the glutes with rotation. But I think those things also come down to normalizing the tension so you can express your ability to use the muscle as effectively as possible. So with this one, we look at some people with chronic ankle instability, which classically makes it very difficult to use your glutes properly just because you don't have that stable place, that stable ground position to be able to spring from or to generate strength from. So it's very hard to express your hip stability when your feet are always moving. You don't have a stable place to move from and to start to kind of build that awareness and that strength from. So we see that it was very simple with this tape application. They just went right around the greater trochanter there, and that's moving kind of from almost like PSIS down around the trochanter, and then also anterior to the hip as well. And what they saw, this is interesting here, they saw that the ability to generate force right afterwards was increased. They also saw that the EMG activity was decreased, which is quite cool. And this is exactly what we would want to see in tape. And so they concluded that the application of kinesiology tape is effective in increasing the muscle strength and reducing the EMG activity of the glute medius muscle in athletes with chronic ankle instability with ipsilateral hip abduction weakness. Thus, the application of kinesiology tape can be used as an effective tool in combating hip abductor weakness. Kinesiology tape can be used to prevent injuries for rehabilitation as well as enhanced athlete performance. So essentially, what they saw was the people in the study who had the ankle instability, the glute medius was always active, was always overactive, trying to create stability, and but it was weak, which we would expect. That's kind of what happens with any kind of chronic muscle issue, is that the muscle doesn't ever relax, but it's not very strong when it goes to contract. We saw the exact same thing with that low back study we mentioned. And so again, we see another piece of data that shows us that the tape normalizes the tension so the muscle can actually relax. But when you need it to contract, it contracts in a way stronger way, much more effective and strong expression of the muscle. Being that there was no exercise done here, it was just being able to contract the muscle as effectively as you can in that present time. All right, and so the next kind of pieces, we'll kind of get around our head around that proprioceptive idea, where all we're doing is just providing feedback to the brain, knowledge to the brain so you can express yourself properly. This one looks at if we tape glute medius, what happens to our ability to kind of use the ground, be more efficient in terms of functional abilities, squatting, things like that. Here's how they taped. For the application, it's just tape over top of the glute medius, over top of greater trochanter glute medius. And they found that the results of this study suggest that kinesio taping is an effective method of improving the dynamic balance and deep squat quality in normal healthy individuals. Hence, taping can be considered as a useful adjunct to various strategies using in improving balance and deep squat. So again, it just helps your body be more aware of the lateral abilities of the hip, and so now you can express all these functional things, functional movements in a more effective way. And then lastly, we again looked at kind of our glute medius application, and I wanted to show that with this application, this is how they tape. This is the exact same as we did with the other ones. We're just kind of crossing over top of the hip. But they also taped with rigid tape and placebo tape, and they all had great results. So their conclusion here is, regardless of the type of taping applied, kinesio taping, rigid taping, or placebo taping, a significant increase of glute media activation was noted in all exercise immediately after taping. Again, immediately after, so we can put this on and expect immediate results. At none of the stages of examination were the differences between the groups significant, which may point to the placebo effect of the tape. So they're trying to downplay it, but I say that what all three tape jobs did was it stimulated the skin. Kinesio tape is the only tape that you could use for golf. Everything else is going to restrict range of motion. It's going to pull on your skin. It's going to be sore and painful. Kinesiology taping is the only thing that's going to allow you to play it, use it while you compete, use it while you do anything in life and be satisfied or happy with how it feels on your skin. So it kind of just, to me, this highlights the proprioceptive benefits perfectly of using tape on the hip. All right. We're going to talk a little bit about fatigue as well, and it's really, fatigue is important anywhere in the body, but I think when I think of like our athletes, like if you're walking 18 or walking 36 holes a day, whether it's college or junior golf, you're doing that multiple days in a row, you can get sore, you can get tired. And so that's also another piece where I'm always going to be thinking, let's get tape on the area that they're sore. And I expect that will help them restore their normal movement patterns in that area and help them be less painful as well. But that's kind of what I'm after, is anyone who we've gone through a training camp and their feet are sore or their legs are sore, whether it's the hips, the quads, the back, whatever it is, if it's a DOMS related, delayed onset muscle soreness from exercise or from using the area more, if it's just from competing and you're more than usual and you're sore, I'm getting tape on there, and I'm confident we're going to restore those normal movement patterns, which means more precision in your swing technique, even when you are fatigued and sore, and that's the time you kind of get sloppy and kind of lose that ability for like that precision. Another thing too, if you find your athletes is getting like at the end of their round, if they're kind of falling apart because they're just not able to be as precise in their movements, then again, get tape on the area where they tend to fatigue, and you'll be in business. So with this study, what they did was they fatigued the ankle. They checked balance pre and post, and what they found was, with their ankle protocol here, they just did that step ups as many times as possible until they couldn't do it anymore. And what they found was with tape that they got back to their, essentially almost back to their non-fatigue balance standpoint, where without tape their balance decreased significantly. With tape they're able to get very close to their normal ability to create balance and body awareness. And many studies will show this exact same thing. This is not unique. This is over and over again. If you get tape on the area of the body where you are sore, where you are fatigued, you're always going to get benefits in terms of performance or restoring performance, but also from pain standpoints as well, and muscle, and kind of, again, being able to be strong and generate force almost getting back to your normal state. All right. And then so to conclude in the present contribution, we showed that an adhesive tape that is adequately placed on the skin can provide sensory information that compensate for the less accurate muscular proprioception after fatigue. The positive results that we obtain with young and healthy subjects could justify further investigation to better understand how cutaneous stimulation could allow for enhanced postural and maybe dynamic movement control. Yeah, same mechanism we've talked about the entire day. All right, excellent. So that covers our sway and slide. We're gonna move into our last two pieces here, which is our C posture, our kind of bent forward posture, as well as flying elbow. For me, this means we're looking at the ability to restore normal thorax motion as well as shoulder external rotation. For golf, those would be the two most important things. And so for the shoulder, we're looking at external rotation, both in the backswing and through the follow through, proprioception and restoring those movement patterns. And then for the thorax, we're looking at being able to kind of recreate extension, help with rotation, and then help with the ribs' ability to move as well. So, from a painful standpoint, people with rotator cuff tendonitis, what we can expect, and here's a tape application that they use in the study. This is very similar to our Pro Cut that I would use day in and day out for this one. The Pro Cut's just easier because it just essentially guides you to reproducing what they have here. And what they showed in the study is that is right away that in this present study, they compared it to cold therapy, but the green is the tape. So we saw that we're seeing these like 50% improvements in the pain right away, 25% improvement, excuse me, 26 and 22% improvements with activity. And then when we get into range of motion, we see that on the next slide there, we see like an improvement in external rotation immediately by putting tape on the shoulder. And again, what I think they're doing there is they're just getting the muscle tension to relax. They're taking away that any kind of a bit like bad posture that's kind of bringing the shoulder rounded forward, and now all of a sudden you can express your normal range of motion. That's really what we're doing there. And then as a result of expressing your normal range of motion, we also increased our grip strength. Again, we're just able to express ourselves in a better way because our nervous system is not dealing with postures and patterns that are suboptimal. All right. And so what I would, if we click through to our next piece there, I think the most important thing with this is just to get tape on the area of the body that is tense. We've talked about this a bunch. And so here's an example of someone had kind of an upper trap dominance. They had a bicep tendon irritation, some bicep tension, and then maybe even some infraspinatus tension in through the tricep. This is how I would tape. The principle being get tape on the area that you feel that is tight, that you feel is creating a posture that is hurtful in terms of their normal mechanics, and you'll be better off for it. And this is how I would say you're going to have the most effect on your patients and clients versus just trying to kind of tape for a specific range of motion application. Okay, good. And then our next piece, we kind of continue this proprioceptive idea. The last one was a thought of we're helping people who have tension that is reducing range of motion. We now look at study with using tape with hypermobile people, Ehlers-Danlos diagnosed patients. And we see a similar thing where even though that they're hypermobile, the tape application is similar. Even though they're hypermobile, by getting tape on the area and by normalizing the tension, that they're able to express their range of motion in a more effective way. And if we look at external rotation with these people, these patients, we see immediately a 9% improvement, and then after 48 hours, an 11% improvement. So another example of just where get tape on the area where we're tense, and all of a sudden we can express our range of motion in a better way. Okay. And then it conclude that a common condition manifesting from decreased proprioception and shoulder active range of motion. Kinesiology tape crossing the GH joint is an inexpensive and relatively safe intervention that may offer temporary improvements in shoulder rotation, active range of motion. Okay, fantastic. And so with someone who we needed improved proprioception, whether they're coming back from an injury or they're just feeling tight and tense, or they're dealing with some subacromial impingement or just some shoulder soreness, I'm going to use the shoulder ProCut. Again, it touches on all our important areas, that AC joint and through the bicep, tricep, the deltoid, as well as up and through the supraspinatus and then the infraspinatus as well. So we get all this connection with the tape, and it takes 10 seconds to put on, super easy to apply, and again, looks really, really good. So your patient's perspective of impression of what you've just helped them with is quite high, and I promise you they were going to show their friends. All right. So if we move into our ribs, our thorax, and our ability to kind of create rotation, we have a study here that looks like just that. It's about kind of helping with a round of shoulder posture, and then the benefits of that we see with that. So the next slide we'll kind of click through is we can see that that's the tape application they apply. We're kind of just getting someone away from here and towards this position like that. And they compared it to pec minor stretching as well. So what we see is over 6 weeks, we see a 28% improvement in the ability to, so in the posture of the patient. And then even taking off the tape for 2 more weeks, and on top of that, there still is a 21% improvement in their posture. And then we also saw that their chest expansion, the mobility of their ribs improved by 33%, and their ability to use their lungs as well, their diaphragmatic strength and their maximum inspiratory pressure increased by 12% over 6 weeks, and then continue to increase even after the tape and taken off for 2 additional weeks. I would say that's the reason. The reason was because their posture improved, and all of a sudden they were continuing to use their muscles of respiration in a more functional and effective way, so that the strength continued to improve. And so how I would generally tape this is a bit of a touchy one, because the conclusion here is that the functional correction technique using K-tape conducted for 6 weeks with 50% tension can diminish forward shoulder posture, with the effect of the treatment being retained for 2 weeks post. The intervention effect was also shown respiratory improvement, including strength in inspiratory muscle and expanding their upper, middle, and lower chest regions. So better posture, better rib mobility, and better lung function. And so how I would generally tape for this is using the posture ProCut. And the reason why I would use this one is because we want to make sure we're not locking them in place. We do need to be able to rotate, to kind of round forward in the golf swing, so we have complete control here with how much tension we'll use. Generally, what I'll do is I'll have them take the posture that we want to promote, so kind of just an anatomical position, and then apply the tape with no stretch. And then I find that gives enough freedom to go forward to not change the range of motion in terms of rotating. I find it helps it, but it does give a reminder kind of to straighten up, which allows them to express their rotation in a more effective way because of that improved mechanics, without that hunch forward position. And I would expect to see that both in the mid-back, the thorax, but also the shoulder as well, as we kind of if we're rounded forward, our shoulder external rotation is limited here. If I straighten up, all of a sudden it's way back there. So that's one of those things that just by having that on the mid-back, I'm also going to express some better rotation into the shoulder joint as well. All right, Fantastic. And our last piece is going to be our scooping. This is, we've done a lot of work with this one. This one is, I'll finish here. We've used Spidertech on the wrist to help with a scoop position, kind of like flipping through the ball. And we've done a bunch of work with 3D testing, kind of with the normal golf, having them pre and post tape. And what we do here is we'll put tape on their trail hand. We'll apply it to the, we'll see in a second. I'll show you a diagram there. But so I'll focus mostly with just the mechanics of the wrist here. But obviously with our scooping, our kind of flipping through the ball, usually it's a result of not having the rotation through our lower body, not having rotation through our thorax or our shoulder. Like something along the way is getting in, is making you flip through the ball, whether it's early extension or all the things we spoke about. So I'll generally use this as a training aid, a way to get the feeling of keeping that impact position strong after we've cleared up all the problems downstream. So after we cleared up the lower body, the thorax, the shoulder issue that is making them flip, then we'll start using the tape as a training aid to help them kind of keep that impact position as they work with their golf professional. So this is how I'm going to apply it for that training aid for the wrist. I'm going to put tape on the back of the hand, and then the same way we did with the postural pro cut, we're going to have them take wrist extension, the position we want them to promote or we want them to keep, and then I'll put tape on the other end of the strip will go on their forearm, and then all we have to do from there is just have them flex their wrist, and the tape will adhere to the rest of the skin along the way, to the entire forearm and back of the hand. And then what that will do is it will allow for still full flexion, but it will promote an extended position. So like it feels like it's easier to get here. And as I mentioned, we did a bunch of work with 3D analysis, and instantly by having the tape there, people would take a better impact position, or at least more of like what we'll say a better impact position is with like trail arm extension, and kind of that lead arm would be kind of flexed through the ball versus flipping through impact. And so, yeah, as I mentioned, a great training aid, a great way to kind of train the groove those patterns if flipping through the ball is a problem. And then also this has benefit for pain as well, because obviously flipping through the wrist can cause issues. The wrist can also be stiff because of arthritis, because it's jammed up, because of muscle tension. So that can be a real reason as well. It might not be that the mechanics are poor somewhere else. It might just be the wrist is all jammed up and muscles are tight. And so with this study, we look at just that, effects of kinesiology tape on pain, range of motion, hand strength, and functional abilities with people with hand OA, arthritis. And they concluded that obtained results of the study show that kinesio taping and hand exercises may have a positive effect on the improvement of pain, range of motion, hand strength, and upper extremity functional abilities in patients with hand osteoarthritis. So whether it's a stiffness in the wrist, a kind of local issue, or if it is a result of a swing issue, this application we'll use tons and tons and get great results in helping the golfers. All right, so back to our review. Okay, so we did 4 big topics in a very thorough way, in my opinion. Hopefully you agree. So we touched on swing faults and then movement mechanics and how those two things intertwine. We backed it up with some research that showed the mechanism and what the expectation would be with taping that way. And then we talked about playing through fatigue and being injured and how we can think about doing that as well. So a lot here in one webinar. I hope you enjoyed it as much as I did. And then we touched on our goals again, which was to help with performance and injury, as well as learn how to tape for those areas. And so all things hopefully you would agree we were successful with. And then With our Spidertech tape, we're always going to leave that lasting impression because our product is high quality, the highest quality, and it is visually appealing, and so it becomes a conversation piece many times with your patients and becomes kind of your business card walking around with all your patients while you continue to help them while they continue to receive therapeutic benefit. Okay, so that wraps it up. Let's jump over to our Q&A. Any questions you have, fire them over. Golf or kind of golf adjacent related. Yeah. Thank you, Gabrielle. Excellent. So, was asked, can you address golfer's elbow? And then also Ken mentioned taping for tennis elbow. So where I'll generally go with those, and so golfer's elbow would be our medial epicondylitis and tennis elbow would be our lateral epicondylitis. How I'll generally address both those, and I'll address them very much actually in a similar way because I want to know where the tension is. And so I'll generally have them take kind of test their flexion and extension through their wrist. With our golfer's elbow, I'll generally expect their extension to be limited. I want to see how far they can get that hand down. We kind of want to get as close to that 90-degree angle as we can. If we find that that's limited, and if the limitation is in all the flexors of the forearm, that's where I'm going to get tape on the flexors of the forearm all day long. To try to normalize the tension there and try to get them to be able to express that extension well. And so that would be, so again, if we see someone who's like scooping or flipping and we think it's just a wrist or forearm problem, that's where we're thinking that, okay, they're probably going to have some tension in through the forearm flexors, and we're probably going to have the tennis elbow be the injury, and wrist extension is going to be the range of motion that's limited. So I'm going to get tape on here, and then most times I'm going to consider getting tape on the backside, as we talked about, in a structural way to kind of promote that. So we'll do the tape here to here, which gives a little bit of like promotion like that, just to keep trying to get them into extension as all the flexors and through the forearm relax and normalize into a better place. And then for our tennis elbow, I'm thinking the exact same thing. I'm thinking, well, we're probably going to have some tension in through the extensors of the forearm, and if that's the case, I'm going to get some tape. I'm going to flex the wrist down, and then get some tape on the extensors and hope to normalize that area. And then the same way that for a golfer's elbow, I expected to see. I want to get close to 90 degrees here. I also am going to try to get close to 90 degrees into flexion for our tennis elbow as well. With golfers, though, especially up here in Canada, who people hit off of mats all day long, well, for half the year as well. A lot of times we'll see that people end up getting tennis elbow as a result of not having the extension in the forearm. And the reason being is so as they come through their impact, if they're not able to get into that full extension of the wrist, that as they hit the mat, their wrist isn't going into a stable position of full extension, but the force of the impact of the mat is able to kick it back and get it into full joint range of motion. So in those situations, we'll see a lot of times some a joint irritation through the wrist, a tennis elbow through the muscle as a result of the flexors being tight and not being able to express full extension, and then the impact forcing it back and causing that shock up through the muscle. So with both of those conditions, I would always go back to the principle of let's check the range of motion, let's see where we are in terms of the wrist and forearm function, and then tape appropriately from there. And so to finish a thought on the tennis elbow, if that's the case, if I'm still tight through the flexors, but I'm getting the pain through the extensors side. I'm going to get tape on the over top of the spot on through the forearm extensors that sore and over through the elbow. But then I'm also going to get tape on the flexor side to normalize the tissue tension in through here and get those muscles to relax and into a normal state of being able to kind of help the joint into its normal expression. Any questions on that? Yeah, thank you. It's a great question, and it kind of comes back to our whole theme of let's test the mechanics. Let's kind of keep. We're trying to figure out where the issue is, range of motion wise, functional wise, and then we kind of use the tape as that mechanism to normalize the tissue tension. All right, guys. Well, this was tons of fun. Touching on a subject, as I mentioned, that is near and dear to my heart, and so hopefully we gave you lots of ideas as to how you can help your golfers, both in the clinic, but maybe even on the golf course as well, on the range. Certainly have a bunch of experience both in those avenues, and so use this information, connect with your local golf professionals, be the person who enables them to do their job better, more effectively, because you open that window for them to be able to be more effective and efficient with their instruction. And I promise you, if their athletes are getting better, because every time they show up for their lessons, that they're able to do more and to kind of execute what their golf coach is asking them to do, you're going to have a lot more golfers coming through your door because you're making other people look good, and that's in my opinion the best way to kind of create those pro golf coach relationships. Well, we'll sign off for webinar number 15. Thank you, everybody. We'll see you back here next month for number 16. Hope everyone has a great rest of the day. Bye for now.